Welcome back, ladies and gentlemen. Tonight, the UK COVID inquiry is kicking off, and there has been a massive leak of Matt Hancock's WhatsApp messages, indeed messages between the entire UK cabinet at the outbreak of the corona crisis. And oh my God, Westminster is absolutely frothing and howling at the moment. I've said for quite a while that someone is going to have to take the fall for this horrible mess, and that person is going to be Matt Hancock. Yes, the most disliked person in the whole fiasco that was the COVID outbreak and the subsequent lockdown and all the horrible stuff that has been going on. Matty boy, despite trying to rehabilitate himself, has been making himself even more unpopular, digging an even larger hole. And now that this stuff is coming out, it's looking bad for Matty Hancock. So yes, the UK COVID inquiry, I believe, kicked off at the start of this week. This will not be examining the vaccine. For the moment, at least, the vaccine is still safe and effective, but there are some interesting things in here. Of course, this is mainly going to be a lessons learned exercise. What could we have done differently, right? Which is, basically another way of saying, gee, did we screw up? And, blame will be apportioned out to certain people. But as I said, somebody is going to have to take the fall, and hard, for all of this stuff. It has now been 3 years, and there has been no justice served. Many people are still very, very pissed off. Trust in government has been declining at a precipitous rate, and if they don't do something to stanch the flow and publicly crucify someone so that they can move on and say, oh yes, this was just an isolated mistake, it was just one bad apple out of the whole cabinet, no one is going to trust them again. This is a classic trick in government. Instead of admitting that the entire process is fraught with problems and basically a reason why government really shouldn't do anything at all. I mean, not to be extreme, I'm not one of those people who believe that, you can live without a government. Much to my annoyance, I think you do need one. But really, they should be as small as possible and do as little stuff as possible. And the reason why, of course, as we have seen over the last 3 years, is that as soon as government starts getting these very, very big ideas, as soon as they start thinking basically, we can solve the problems that God has ordained us, they just generally make things worse. So meaning its aims, the inquiry will, its first thing, consider any disparities evident in the impact of the pandemic on different categories of people. Oh my God. So their first thing is, how did it impact diversity? Oh, mate, I'm not hopeful. Including but not limited to those related to protected characteristics under the Equality Act. So, great. So they're going to spend a whole bunch of time saying, were black people more affected than white people? Were trans people more affected than straight people? They should just be looking at economics, right? Were poor people more affected than rich people? And the answer, of course, is bloody yes, because that's the way the world works. If you've got, money, it's always easier to skirt around these kinds of things. B, listen to and consider carefully the experiences of bereaved families and others who have suffered hardship or loss as a result of the pandemic. Although the inquiry will not consider in detail individual cases of harm or death, because that would create bad press, presumably, listening to these accounts will inform its understanding of the impact of the pandemic and the response, and of the lessons to be learned. So this will be a, sort of mass apology. They're not going to apologize to anyone specifically, because to do so might create a tricky legal liability where they might have to, pay them money, and could open other sort of thorny questions, particularly about the ones about the Liverpool pathway and midazolam, which the government definitely does not really want to get into, although it may be unavoidable. C, highlight where lessons identified from preparedness and the response to the pandemic may be applicable to other civil emergencies. Oh, great. So does that mean the next crisis that comes along, they'll be like, okay, we're going to do the lockdown again, but we're going to do it differently this time. We're still going to violate your civil liberties, but, we'll be a bit more careful in how we do it. D, have a reasonable regard to relevant international comparisons. and produce its reports and any recommendations in a timely manner. So they can't drag it out for years, presumably. And they really can't drag it out for years, ladies and gentlemen. 2025 is fast approaching the next 5-year plan to be put into action. And they can hardly do the next thing unless they have said that they have listened and sort of, low-key apologize to all the people they hurt in the first thing and say, this time in 2025, we're going to do the same thing, but we're going to do it in a more kind and caring fashion. This goes basically on. It's quite comprehensive. It covers it covers the use of lockdowns and other non-pharmaceutical interventions, such as social distancing and the use of face covering. I don't know whether that means whether they're actually going to question whether they should have had a lockdown or not, or whether they're just going to split hairs and say, oh yes, well, we had the lockdown, but was it really appropriate to do it in this specific way? My money would be on the latter. The impact of mental health and the well-being of the population, and a whole bunch of other stuff. Basically, did it hurt victims of domestic abuse? Did it hurt people in the prison system, the justice system? Did it hurt immigrants? Etc., etc. And a big thing on the response of the healthcare sector, including the management of the pandemic in hospitals, including infection prevention and control, triage, critical care capacity, the discharge of patients, the use of do not attempt cardiopulmonary resuscitation decisions, the approach to palliative care, workforce testing, changes to inspections, and the impact of staff on staffing levels. Now, that's a very broad remit, but tucked in there about the palliative care is a potential route into asking about midazolam and the Liverpool pathway. However, I highly suspect that they will skate over this. So, as you can imagine, if you are an observer of politics, the government is currently casting around, looking for someone to blame, and trying to figure out who is going to get shat on and who is not. And poor Matty Hancock. Oh god, he looks like such a gormless fuck. Yes, poor Matty Hancock. He's in the firing line. 100,000 WhatsApp messages that he gave to Isabel Oakeshott, the journalist who wrote his memoirs, which had a title so anodyne and useless I can't even remember what it was. It's probably something like, my heroic struggle as health secretary. I saved all your asses and I don't even get the credit for it. Why won't you love me? Actually, that'd be a great name for his memoirs. Why won't you love me? Oh my god. This has come out with some rather interesting accusations. So, the most important one that is going around at the moment is that allegedly Matt Hancock did not tell nursing homes to start testing everybody who came into old age care homes at the time, thus spreading COVID into thousands of care homes, which caused many, many old people to die. There is a little WhatsApp message here where he's basically saying that, we don't need to, test for these people, just people who have come out of hospital. And it turns out that the main way that COVID got into these care homes was from staff and just people in the ordinary community coming out. Now, this, of course, has made many, many people enraged. Hancock has hit back by saying that these messages are doctored. Oh dear. But the thing is, ladies and gentlemen, he is probably, in a sense, right. There are 100,000 WhatsApp messages, and the Telegraph has printed probably less than 100 at the moment, right? So there is definitely scope to say, this was slanted in a certain way, and the Telegraph is certainly making a hell of a lot of press off these. According to Mr. Hancock, he says that the messages don't tell the entire story. That there were not enough test kits to test everybody going into care homes. That's certainly correct. There was also another article, at least I read this morning, but I can't find it now. Perhaps the Telegraph has memory hold it, talking about how Hancock, in his rush to reach a testing threshold of 100,000 tests early in 2020, basically started fudging the numbers, and how at least 20,000 of those tests were basically in the back of an Amazon truck that had just left the warehouse, and so therefore got counted towards 100,000 total, and that he knew at the time that 80% of these tests were not being returned, meaning they were basically useless and just wasting insane amount of resources that could have been directed to the NHS. One of the figures that does seem to come out quite well, at least from the leaks that we have seen at the moment, is Boris Johnson, who generally gives an impression of not really understanding the science very much, but having a sort of liberal reflex and continually asking, couldn't we just, let people decide for themselves? It also reveals that people like Boris Johnson, they basically just get their news from the mainstream news, like a lot of normies. You know what I mean? Here he is quoting an article from The Spectator. He apparently very much likes to drop, news links in the government WhatsApp chat. There is an exchange between him and Chris Whitty, I believe. I can't get into the Telegraph without giving them info, and I'm not doing that. And they have cunningly designed their site now so that if you use archive.is to scrape it, you don't get the entire thing. But essentially, to give you a gist, right, he reads an article in The Spectator where he says that the mortality rate of COVID is just 0.04%, down from 0.1%. Now, as we all found out later, the overall risk of dying from COVID was about 1%. And it varied very, very much by age. If you were very old and you were very sick, you had a distinct chance of dying of it. But if you were young and healthy, your chances of dying of it were basically negligible. And Boris even talks about this, asking, really, do we need to shut down the economy? But for some reason, his, opinion did not carry the day. Now, I'm not exactly sure why that is. I would have thought that it would have been the PM's job to sign off on this, but perhaps he was like, oh, well, I don't really know much about health. It could be a bad thing. I'm just going to, listen to the experts and read The Spectator. Fucking jag off. Jesus fucking Christ. Is this really how governments run? I gotta say, I mean, from what I've seen, it just looks like a massive parade of incompetence. Incompetence just so bad that you just wouldn't, they're just, Hancock in particular is just making shit up as he goes along and then turning around and saying, like a consummate politician, oh, we've got to get people to do the thing, and just lying through his teeth and saying, oh, yes, we're following the science. They were doing no such thing. What they were doing was engaging in social engineering in order to get people to do the thing that they had decided, and not giving anyone any real sort of insight into the fact that the science was still developing. And as I said, Boris seems to have been pushing back on that. Now, if this is true, then Boris is going to come out of this smelling like roses. He is going to be able to say, well, I obviously didn't support the lockdowns. I wanted everyone to make their own choice. But then, the scientists told me I'm not a scientist. I'm just a bit of a buffoon, really. Whereas the people that are going to come out looking very, very bad are people like Hancock and Whitty and the other scientists who, basically decided to do the whole lockdown thing, Hancock in particular. There has also, on the back of this leak from Isabel Oakeshott, been a call from the COVID inquiry asking people if they've got any more evidence, asking for leaks, particularly WhatsApp messages. If anyone else has WhatsApp messages from the government, please leak them to the inquiry. And I got to say, the head of the COVID inquiry, Baroness Heather Hallett, seems, at least on the surface, to be quite determined to make this into a real inquiry. Now, I can't see how this is possibly the case. I don't know why they would let someone who wants to do a real inquiry head this thing when it could be explosive. But on the other hand, Labour is waiting in the wings in the UK for the Conservative Party to keel over like the wounded elephant that it is and expire so that they can get in and have a shot at, implementing all the stuff that the World Economic Forum wants them to do. So, perhaps there are a bunch of Labour people in there being like, this is the chance that we have to kill the Conservative Party. To be perfectly honest, they've basically done for themselves in the first place. You can hardly blame Labour for taking advantage of such a thing. So we are going to see whether there are going to be even more leaks and more revelations. I am looking forward to something really, really juicy, personally. At the moment, none of this is anything I didn't really know or suspect beforehand. I'm sure, however, the normies will be shocked. They will be shocked to know that government doesn't have a clue what it's doing. For people like myself, it's Wednesday, basically. We all knew the government didn't have a fucking clue what they're doing. They're the government. They never really have a clue. Anyway, I will bring you more news on this as it develops. If you got to the end of the video, it's lovely to see you here. Please like, share, subscribe, and all that stuff. Come along to the live stream tomorrow night, Thursday night, 8 p.m. GMT. Have an hour of joyful interaction with me and people in the chat. It's on Rumble, though. Actually, this probably won't be going up on YouTube because it's probably too spicy. Or maybe not, actually, given that the Telegraph has said it now. So now that they've said it, I guess everyone can say it. That's how it works. Anyway, I'll see you in a couple of days. Good night.